I do get the larger point you're saying, but I also acknowledge and I'm appreciative of the fact that you are honest with where the limitations of your model of a ambulance aggregator lies. You can ensure that the ambulance reaches on time, but beyond that, you are limited as well. And those are some of the concerns that we look at when it comes at privatizing ambulance service for our people. Do stay on with us, Shafi Mathur, because I'm sure our other guests also would have to make points on which perhaps you can come in and counter as well. Dr. Sanjeev Bagai, Dilip Cherian, and Pradeep Rawat have been waiting quite patiently. Let me start with you, Dr. Bagai. We have an ambulance problem in our country, Dr. Bagai. Would you agree so? Because at this point, by what data I have received, we only have 17,491 basic life support ambulances, which are meant to effectively just take you from your home to the nearest ambulance. And in terms of advanced ambulances, which can actually keep you alive and under control for an extended period of time, we have less than 3,500 of them, 3,441 to be precise here. So there is an ambulance problem, would you say so? If there is this necessarily the solution that we have to look at, outsourcing it to e-commerce providers?
Good evening. So let me just break this down very quickly into 2 or 3 separate parts so that the viewers and all of us get the correct perception. There is no doubt and no ambiguity in the fact that India lacks a comprehensive increase in ambulance numbers and a transport medicine program, not only in implementation, but indeed in health education. Transport medicine or ambulatory care is still in its infancy in India as far as I'm concerned. But having said that, this kind of promise could be highly misleading. It is almost illogical and impractical for an ambulance in any metro to reach within 10 minutes. We have a golden hour of 45 minutes to an hour, but quicker the better as far as the ambulance service is concerned. The question is, who owns the ambulances? Is it just an app to coordinate different hospitals' ambulance services on one platform? Or Blinkit as a company is going to own some of the ambulances? So here comes in the issue of CapEx and OpEx. The cost of owning an ambulance, buying an ambulance is 15 lakhs plus. Then the equipment. Who's going to own the ownership and accountability of the AMCs and maintenance of the equipment? Does the ambulance, it's not written on the news and the media as yet or the social media, who is going to provide a trained doctor? There is no mention of a doctor. We've just mentioned trained staff or a trained driver. That does not necessitate and translate into giving emergency care. What happens to the legal aspects? You have promised 10 minutes. Say, for example, the ambulance comes on minute 12 or minute 15 and the patient dies in between, unfortunately. Who's going to take the onus of responsibility? What happens in the transportation in case a patient dies? Will a corporate group of hospital named A lend its ambulance to take a patient to a corporate hospital B? These are practical issues which need to be addressed.
Fair enough.
So I would tread very cautiously. I would tread very carefully. To resolve this problem, we need more number of ambulances. To give you last 10 seconds, to give you a ballpark figure, a large corporate hospital of 500 beds in any large metro in Delhi will not have more than 7 to 8 ambulances, basic life support and advanced cardiac care. These are extremely expensive, extremely difficult to maintain, and the manpower is expensive to run these. Just a platform is not going to give an answer. 10 minutes, according to me, is over-fantasizing it, over-promising, perhaps will under-deliver.
Okay, so let's assume that, let's not hold, if we look at be devil's advocate and let's not hold Blinkit to a 10-minute guarantee, even if, say, Blinkit decides to make ambulances more accessible to me, and perhaps maybe some people will say people are used to booking a cab on Uber or booking something on Blinkit, so it's easier for them to book it rather than be on a helpline and wait for customer call. Even if it makes ambulances more accessible, does that still solve a problem?